The most difficult part of the job is the fear that the patient comes to the table with. There's a lot of time that just needs to be spent to educate them, to help them understand so that they can diminish that fear and really take part in their treatment. My name is Cynthia Knauer, and I'm a clinical research coordinator at the Mount Sinai Medical Center in New York, New York. I would explain immunotherapy as a type of therapy that is teaching the patient's own body to take care of the cancer. The immune system has lots of checks and balances within it that cancer learns to override, and then the therapy gets made in a way to reteach it how to break down those barriers and to attack and stop the cancer. With chemotherapy, it is attacking rapidly dividing cells, and it's those rapidly dividing cells that die off that cause the side effects that we see in terms of hair loss, nausea. With immune therapy, it's a targeted therapy. It's going after a specific antigen that a particular cell makes, and it's attacking those particular cells. The side effects are short-term. They're easily managed by the patients at home. It could be me in that chair, and that's what drives me, to try and help them get the treatment that they need and the quality of life that they deserve. It's a human connection. And it's something that you basically, see the person in front of you as a family member, as a friend, that you want to take the best care of. When these treatments work, it's just amazing. I mean, you go for years and years where you don't have anything to offer these patients. So it's a very exciting time to have been involved in these clinical trials over time and finally see it approved and making a difference for a population that had nothing in this area of their disease. We don't find new treatments unless people participate in clinical trials. That's the bottom line. So it's very important that if you have a diagnosis of cancer, that you look online, talk to your doctor, talk to your healthcare team, see if there are clinical trials that you might be eligible for. When you are able to make a difference in a patient's life, and when you see a treatment work, that is absolutely the best part of my job. The answer is much closer than we think. It's inside each of us. So science is looking at human beings and our processes and how we can harness them to help fight cancer.